Good morning, everybody. My name is Blanca Castro, and I have the pleasure this morning of being here at the press conference for Senate Bill 650. This is the Corporate Transparency and Elder Care Act of 2021. This is, for AARP, one of the most important nursing home reform bills that we have in the legislative session. And as you all know, right now the legislature is still in session through the remainder of the week. And so it is my pleasure, and we would like to be able to introduce Senator Henry Stern, who is the author of Senate Bill 650. Senator Stern is in a hearing, and so we were hoping to pull him out so that he can provide you an overview of the important elements of this bill and why we really need it to pass in 2021. And so if I may, I'd like to introduce Senator Henry Stern, who represents Senate District 27. And he represents over 1 million residents in California and has been the champion for this corporate transparency bill. And with that, I'd like to turn it over to Senator Stern. I will go ahead and give a little brief background while we wait for Senator Stern, but AARP has chosen to be a co-sponsor for Senate Bill 650. And quite frankly, the reason being is that we need transparency. We need to know where the millions and millions of dollars that nursing homes receive from Medicare, from Medi-Cal, and private care insurance are going. With no further ado, we have the pleasure now of having the champion and the author of SB 650, Senator Henry Stern. And Senator Stern, I'd like to turn it over to you first.
Well, thank you, Blanca, and thanks for kicking us off here and for AARP being always fearless when it comes to protecting our seniors and the people who have frankly suffered in silence for a large portion of these last couple years. I've gone through my own personal struggles with life in nursing homes, with my own family through this pandemic, and it's humbling to see what the caregivers and what our seniors are going through as they're aging. And a lot of us want to pretend like this isn't an issue because we can live our normal lives. I'm, 39-year-old guy. I would normally not enter a nursing home or even be aware. You drive right by them on the street. But you don't realize that it's life and death going on there. It's the difference between dignity and indignity, and it's also a lot of money. And that this is an industry, and we need to be clear that it's not just about this pandemic, but the way California law is set up and the way we've built our healthcare system has led to a dynamic where the vast majority of skilled nursing facilities in California are for-profit and are privately run. Now, some of these operations are smaller. They'll talk about the mom and pop outfits and the 6-bed facilities, people trying to just find a way to make a living by doing good. And there are a lot of angels out there doing that work. I know many of them. The San Fernando Valley happens to be one of the epicenters of this kind of nursing care in the whole state. But what we found from both LA County's audit, from state oversight, from investigative journalism, that we've seen some incredible reports, is that the corporate side of this industry, the larger for-profit institutions, are transacting in the billions, not the millions, but in the billions between what they call related parties. And there are multiple organizations within a single corporate umbrella that may supply, have operations, conduct leases. One entity may own the land, the other entity may supply diapers, the other may supply food, the other may supply transportation services, but they're all related under a common ownership or management structure. And that those transactions between related parties total multiple billions of dollars in any given year. And then we have very little idea about whether those transactions are actually being taken in a way that is fair. that prices aren't being inflated, that money isn't being wasted, or that profits aren't being unjustly pocketed. I mean, the thought that my mother-in-law on Medi-Cal, who paid her taxes for her whole life and worked hard, working class Californian, has to wonder for thousands of other people like her, whether or not that extra nurse on the floor that you so desperately need, or that extra LVN or RN, whoever it is, those shortages that we're seeing, that is literally leading to death without dignity, people dying alone, people not being able to sip out of their sippy cup when they have Parkinson's, or ability to get a diaper changed. We're looking at other ways to crack down on some of those abuses, but a lot of it is that the system itself is being starved. The care economy itself is being starved. We are now about to undertake the largest ever investment in skilled nursing care and in Medi-Cal in the state's history. This is a historic budget. We're going to be spending billions and billions more dollars to make sure our caregivers are taken care of so they can do their jobs, that there's adequate staffing, and that people in our nursing facilities are treated like human beings and not like cogs on a profit and loss sheet. But unless we have SB 650 in law, unless we actually know the nature of these related party transactions, there's an ability to erect a very insidious shell game of moving money around and not knowing where it is, that we could be seeing billions of dollars in waste and abuse in this industry, where those dollars are so desperately needed on the front lines. So I'm really hopeful and insistent, frankly, that we get this legislation done this year. I do not believe this is an issue that can wait. We know that OSHPD and the governor's office are looking into audits of past history in some of the skilled nursing facilities for their profits and their losses under prior legislation passed. But even that legislation will still not yield the transparency that we need into these actual transactions that we're talking about. There's a way to get very creative about accounting. And we think that this bill punches through any gamesmanship and really gets down to the truth of these matters. I don't think this will necessarily affect the entire skilled nursing industry, but I think the bigs, the multi-billion-dollar corporations, have to be held accountable here. Too much is on the line. This one's personal, I know, for all of you, and I really want to thank also SEIU. It's been just incredible, not just on the bill, but on putting their lives on the line. I know so many workers in LA who lost lives or lost families' lives for doing this work. And frankly, for Canner for just being a stalwart over the years. We have a very unique partnership here. And so I think I owe it back to Blanca. I've probably blown through my time. This is what happens when you give a senator the mic. But I just want to thank everyone. We have a big vote coming up tomorrow. And this week's going to be really crucial. We've got a clear Assembly Health Committee, but I'm confident that Chair Wood's going to move this legislation forward. And I actually believe that I think we're in a good spot to get this bill back to the Senate and off the Assembly floor. And I hope we can get to the place where we can urge the governor to sign this. This is not a next year issue. This is right now. If the pandemic has taught us anything, it's really revealed those cracks in the system. And I don't really know how to live as a proud Californian unless we know we're taking care of the ones we love and not cutting corners or warehousing them without any hope. So thanks again. And I would appreciate everyone's support in calling their assembly member and trying to get SB 650 through Health Committee and through appropriations and off the floor and over to the Senate and then into law. So thank you.
Thank you, Senator Stern. And we will be introducing a couple more speakers from other organizations that are sponsoring, as he said, the California Advocates for Nursing Home Reform and a local SEIU 2050. But the time is now to hold nursing home operators accountable. We talk about over 9,000 lives that were lost. That includes residents and staff. And it's really mind-boggling when you need to imagine that these are not just numbers, but these are mothers, these are fathers, siblings, our grandparents, these are loved ones that people lost, and it didn't have to happen. There was definitely, and this is where we're really focusing on, we need to know, and the public deserves to know, how is the money being spent? If it wasn't spent on increasing the number of staff, and if it wasn't spent on providing masks and gloves and gowns and shields so that you weren't using the same gloves when you were going in between residents, what was it spent on? And that's what we're asking with SB 650. I'd like to now turn it over to one of the key co-sponsors, and Tony Chicotel, representing the California Advocates for Nursing Home Reform. Tony?
All right, thank you, Blanca. Good morning, everybody. My name is Tony Chicotel. I'm a staff attorney for California Advocates for Nursing Home Reform. And I am honored to be here today to speak on behalf of the nursing home residents who were severed from their families and friends this last year and this year, and who died in record numbers, tragically, often alone. Nursing home residents who survived the pandemic and the family members of the deceased residents are rightfully frustrated and angry about the preventable conditions of nursing homes that led to this enormous death toll. But they are more upset by the current inattention of our state leaders, many of whom seem ready to forget what happened and forego meaningful reform. Senator Stern's SB 650 addresses one of the most important and vexing nursing home problems: financial transparency. Nursing homes, as the senator mentioned, increasingly use related party companies to provide services to themselves, and they divert money into profits that was meant for resident care. Hiding profits enables the industry to come back to the legislature every few years and successfully ask for more money. The industry capitalizes on an asymmetry of information. The nursing homes know their costs, they know their profits, and the state simply doesn't. This lack of transparency results in the state getting ripped off, paying for the private jets and vacation homes of nursing home owners instead of the staff and resources critical for resident well-being. Here is all you really need to know about nursing homes. They are, almost all of them are now run by business people with MBAs. They are not run by nurses or physicians or caregivers. For many owners and operators, the goal, the name of the game, is to make money. It's not to provide high quality care. Their greed is enabled and their deception is invited by a reimbursement system that lacks meaningful disclosure of nursing home expenditures. SB 650 requires nursing homes to provide more information about their related party finances, giving them fewer dark corners for hiding profits and giving California more control over resident care. Our nursing home residents are isolated, frustrated, and grieving those who've died. They desperately need a more transparent and sensible reimbursement system. It's my pleasure now to introduce Arnulfo de la Cruz from SEIU 2015. SEIU 2015 is a co-sponsor of SB 650.
Great, thank you, Mr. Chicotel. Thank you. Good morning, everyone. Senator Stern, Mrs. Castro, for your leadership and partnership. I'm proud to be here representing the 400,000 long-term care workers of SEIU Local 2015, including, some of us in the pandemic had the luxury to not have to show up every single day as an essential worker. We have 20,000 nursing home workers as a part of SEIU Local 2015 who every day, many of them making minimum wage, were putting their lives on the line to care for California's most vulnerable. So SEIU 2015 nursing home workers are very, very proud to co-sponsor SB 650 because we feel strongly that shining a light on the lack of transparency by some of California's largest nursing home employers is a fundamental step towards our vision for a long-term care system that puts care first, not profit. And we know that the pandemic really drew attention to the critical condition of California's nursing homes, but we also know that these problems didn't surface during the pandemic, right? Many of these issues have been a long time in the making. We know that the fundamental issues that are built into the system, as many have mentioned here, have allowed nursing home executives to maximize these record profits while minimizing transparency and accountability. And that's been at the cost of resident care and worker safety. And one of these fundamental issues is the ability, as has been mentioned, of ultra wealthy nursing home owners to get even richer by using these accounting tricks, almost like creating shell corporations that are extracting profits on everything from rent to supplies. I think recently the Washington Post reported that there was one nursing home corporation, Brias, which had paid 70 related companies for everything supplies. Some of these owners own executive family members, also stood to benefit. And the whole scheme that has been set up really had one goal in mind, and that was to funnel as many taxpayer dollars as possible into the owners' pockets and away from patients and residents and care. And so SEIU nursing home workers are the backbone of these facilities. I remember being on a conference call with a union meeting with maybe 12 CNAs, and 6 of the CNAs had tested positive. If you ask these CNAs who every day were showing up during a pandemic, why are you putting yourself through this? They would let you know, because I love what I do. I've been working at this facility for 15 years. I'm worried about my patients. I want to do the right thing. So it's absolutely unacceptable that profit is being put over patient care. And we know that the devastating impact that COVID had on nursing home residents and workers really put a spotlight on this crisis. At the same time, as the pandemic fades from the headlines, we can't allow the needs of nursing home workers and those that they care for and the aging population in California not to be forgotten. We're also not going to allow the inequities that exist to persist, right? We know that after COVID-19 left Black and brown nursing home residents and staff unequally vulnerable to illness and death, California can do better. It needs stronger oversight and enforcement to assure residents of color are treated equitably. So we're really, really excited. We look forward to moving forward on SB 650. Also tomorrow, thousands of union members and allies and community folks, we're going to be gathering in Los Angeles and Oakland to kick off our Put Care First campaign, not just in California, but nationally, with workers demanding to be treated with dignity and respect and to put care first. So the only other thing I would add, I'm just going to say a few comments in Spanish. La propuesta de ley SB 650 es últimamente importante porque por muchos años en esta industria de las casas de convalecencia, los dueños, la gran mayoría, sacan una ganancia en vez de invertir los recursos hacia los pacientes, los que están haciendo el trabajo, como los miembros de SEIU 2015, están invirtiendo el dinero solamente con la meta de sacar una ganancia. Nosotros sabemos que podemos hacer mejor como California, podemos hacer mejor para nuestros familiares, nuestros pacientes y los que están haciendo el trabajo, más todavía durante 12 meses de la pandemia, en donde el impacto de la pandemia se sintió muy fuerte en esas casas de convalecencia. Agradecemos al senador, los aliados que están aquí en este foro, y para los medios en español, siempre estamos aquí para pasar ese mensaje tan importante que ya llegó el momento de poner pacientes primero y no ganancias. Muchas gracias.
Thank you very much, Arnulfo. And we want to open it up for questions from the media. We want to make sure that we address as many as possible. And I'd like to turn it over to Shay McCaslin, who will be calling on members of the press.
Thank you, Blanca. Yes, if you do have a question for today's panelists, please go ahead and use the raise hand feature on Zoom, and we can go ahead and call on you, and you'll have an opportunity to unmute yourself and ask your question live. All right, Daniel Witt from, I'll go ahead and ask you to unmute and ask your question live.
Can you hear me? Can you hear me? Can you hear me?
We got you.
So I was just curious. So SB 650, so it would allow the transparency so that the state would be able to see what nursing homes are actually spending?
Correct. Especially when they're spending with parties that are related to them. So all those shell corporations we were talking about.
Right, the key to SB 650, I think the key is that it requires consolidated financial reports. And the term consolidated, I think, is the key here for capturing the expenses to related parties. So that now, not only will we see how much was sent to the related party, but that party's financial report as well, so that we can see how legitimate or illegitimate the expenses of the related party were.
Thank you. And we do have another question from Samantha Young. Samantha, I'll go ahead and unmute you. You should be able to click your unmute button as well. There is a lag time, in case you're wondering about the pause.
Can you hear me? Okay, great. Hi, Samantha Young with Kaiser Health News. I'm wondering, Senator, if you could address this and maybe some others as well. I mean, the nursing home lobby is just so effective at stopping bills like this. And I'm wondering if you could speak to that and what you think your chances are of getting this bill through the process and onto the governor's desk.
You are correct. And it is an industry, and like most large multi-billion-dollar industries, there's a lot put into government relations, and you know, we've come a long ways. The fact that we actually got the bill out of the Senate in decently strong shape, I think, shows that the spotlight, frankly, from the media and from reporters and news services has made it so, you know, this bill can't be weakened in the shadows. I don't think we're there yet. I don't want to say I'm totally optimistic about this getting all the way through, but I will say that my conversations, at least in the near term, with the chair of the health committee indicate that we should have a strong chance at his support tomorrow. But subterfuge comes in many forms, and you never quite know what you're dealing with. So we'll see where it comes from. But so far, I think we've been trying to find some kind of compromise, at least to show that this bill is not intended to go after the smaller entities. We are looking after some of the bigger, larger institutions that have, you know, complex financial audits occurring, and accountants, and all kinds of you know, lawyers and bankers. So hopefully that'll at least take away the primary critique we've seen, which is that this would be some kind of compliance burden or inappropriate administrative burden on a 6-bed facility somewhere in California for someone who may not have all those consolidated financial reports. So hopefully that'll at least take away the ostensible criticism, but you never know quite where it comes from.
Thank you.
Thank you.
If it's okay, I'll just add real quickly that what I like to tell people is that people like the co-sponsors of this bill go to the legislature with white papers, and the industry comes to the Capitol with green papers, meaning dollars. So there's a significant difference in approach. That said, I do think that what happened in the pandemic has resonated with a lot of the legislative leadership. They do stand by having some reform, and I think our argument is persuasive. California is, as a state, is spending $5 to $6 billion a year on this industry, and it's pretty clear that we're not getting $5 or $6 billion worth of care. We're not getting high quality of care. I think that's obvious to anybody who looks at this industry with any depth. So I think it's just a persuasive argument that we should have better accounting for all of this money that we're spending.
And then lastly, this is Blanca from AARP. I will add that this bill, Senate Bill 650, did get out of the Senate on bipartisan support. And that is not a common feat here during these times. So both Republicans and Democrats have come together in the Senate. And we believe that this is a nonpartisan issue. This is something that we need to just drive at. We want to know where the money's going, but most importantly, we want to know so that then we can hold them accountable and ensure that the money's going to the quality of care, staffing, wages, medical care, et cetera. Thank you.
Thank you.
Great, and we will take a few more questions. Again, if you're on Zoom, you can use the raise hand feature, and if you're on Facebook, you can ask your question in the comments. Also, we encourage everyone to please state who you're affiliated with. Our next question is coming from Barbara.
Hi there. Thank you for doing this press conference. In the bill analysis, or one of them, it suggested that OSHPD believes that some of the information you're collecting is redundant because OSHPD also collects it or will start to do so relating to profit and loss statements starting in October. Can you talk about what this bill does that goes beyond what OSHPD requires and why that's important? And then I have a follow-up question relating to why you're requiring a CPA audit or CPA audited results. Thank you.
I'll kick this to one of our experts here, but let me just say at a simplistic level, as a non-accountant, a profit and loss statement doesn't always tell you the full story of multiple related party transactions. And so if you're looking at, for instance, a lease for a piece of land, whether you pay fair market value for that rent won't necessarily pop up in a profit and loss statement. The same for a bulk purchase of diapers or PPE in the case of the pandemic prep. So a lot of those details where we can actually get to that level of granularity that an audit will reveal aren't going to be present in the profit and loss statement, which is why we think that it's a good thing that OSHPD is looking into those that history, but frankly that profit and loss analysis will be insufficient, and so we're hoping to convince them of the efficacy of getting this done and telling the governor the same. But I'll kick it out if anyone else has any insight on sort of the details on accounting or audit side of it. That's my politician version of it.
Yeah, this question's been asked a few times before. I think the main difference between what's now being required to be reported to OSHPD and what's in SB 650 is the current law applies to the licensees of nursing homes, whereas SB 650 applies to the owners. So what we've been very concerned about for many years is the shell game that Arnulfo mentioned before. Facilities, the owners set up shell companies to take the license for each nursing home, so the related party information that we're trying to capture relates primarily to the ownership, to the people at the top of the chain, rather than to the low-level shell company LLC that holds the license. So we're hoping that by connecting the related parties to the owners rather than to the licensee, we'll capture a lot more, significantly more related party transactions and reports. The other part of SB 650 that's unique and different from current laws that the companies are going to be required to send OSHPD a visual depiction, like a flow chart of all their related party entities, so that OSHPD and the state can see all together on one screen or one sheet of paper exactly how all these companies operate and are related to one another. So get a better idea of how the money's flowing. And Barbara, I think you had a second part of that question. I think I might have missed that. Can you repeat that?
Sure. Why does the bill require a CPA audited results, which might be expensive for very small nursing homes? And also, is there a limit on the size of the homes that this bill affects? Like, does it apply to all homes, or does it apply to board and care homes, or just skilled nursing facilities?
It applies to all nursing homes, regardless of size. It does not apply to assisted living facilities. So for skilled nursing facilities, there's about 1,200 in the state of California, and this will apply to all. In terms of the audits, there's still some negotiation occurring on how, for the level of certainty that needs to be provided, the level of accountability that needs to be provided on these consolidated financial reports. The idea with audits is to get with as much certainty as possible that the numbers that are being reported by the companies are legitimate. Another option is for the consolidated financial reports to be reviewed by a CPA using general accounting principles, which will give us less certainty, but significant less expense on the nursing homes. And there's also been some discussion about trying to limit the audits to the larger facilities or facilities that are already having audits performed for other reasons. So I think that's all stuff that we're working through the Assembly Health Committee on.
Tony, we have one more question. We're going to turn one last one, but before we go to Suzanne Potter with California News, we wanted to just ask on Facebook, and it touches on this, that home care agencies will not be affected by this bill. Is that correct?
Yeah, that's correct. This has, I mean, it has no direct impact on home care agencies. Now, some home care agencies may be related parties of nursing homes. So in that regard, their information will now be reported to OSHPD as part of this consolidated financial report. But home care agencies that don't have a financial relationship or ownership interest in common with a nursing home should be unaffected.
All right, and we're going to take one last question. And Shay, can you go ahead and unmute California News Service?
Yes.
Thank you.
Yeah, hi, this is Suzanne Potter from California News Service. I just wanted to ask you, forgive me if this has been asked, what are the main arguments against this bill and what are your refutations of those arguments? Why do you disagree with them?
And take a quick crack, Tony, and then I'll pass it over. I think we talked a little bit about the allegation that there's it's going to be burdensome to smaller skilled nursing facilities, and I think where we're really focused on is entities that have these large multi-related party big corporate structures. So that should help, as well as some of the audit provisions that Tony was talking about when it comes to focusing on entities that have gone through these financial audits in the past or gone through these kinds of transactions. So I think partly about, leave the small guys alone and don't add more paperwork. And then the only other argument we've been hearing, and that this one's been from OSHPD, is we're doing a lot of things already. We're very, very busy. We're looking at their profit and losses statements. And so, wait a second, in layman's speech, just give the bill a pause and let us finish our work. But our point is that the tragedies are happening right now. And, I was looking at our budget numbers. We just put, I think it's, I'll get the exact number for you, but it's $115.6 billion into Medi-Cal. So if we want to wait 4 years on checking on where that money went, that just doesn't make much sense from a taxpayer protection perspective to me, let alone a human dignity or caregiver perspective. But sort of been like, slow down, let us look at this initial tranche of reporting, and then we'll look at the full audit and the related party transactions. But as our response to that is we cannot afford to wait.
Yeah, I've gotten a little bit of a kick out of this argument that it imposes costs on facilities and it will take away from resident care. Well, that's exactly what we're trying to get at, is trying to figure out how much of this money is going to resident care and how much is going to pad the profits of the owners. And we think this spending a little bit more money on financial information that is actually reliable is a great investment for nursing home residents and for caregivers. In fact, in terms of whether or not the information is redundant or necessary, what OSHPD is getting right now, to some extent, is garbage. Where if there's one thing I've learned dealing with nursing homes for the last 20 years, it's that wherever nursing homes can fudge the numbers and make themselves look better without scrutiny, they will do that. They will take every opportunity to make themselves look better so they can come back to the legislature every year and ask for more money. And so SB 650 gives us more reliability on the information that OSHPD is getting so that we can trust it a little bit more and we have a better idea of how this money is actually being spent. It doesn't give us perfect information. It's far from a perfect transparency bill, but it is certainly a step forward and something that we can build on, not only in terms of giving us more transparency, but in actually then requiring a certain percentage of dollars go to care.
And so with that, any closing remarks, Senator? We're going to close it to you and let you close this out. Thank you again, everyone, for joining. Senator?
Thank you, Blanca. Again, thanks to SEIU, Canner, and all the other partners involved with this legislation. But if you're tuning in live on Facebook now, if you're a caregiver yourself, if you have a relative, family member in a skilled nursing facility, or if you're just somebody who actually cares about their neighbors and their loved ones, we're all going to be aging more and more. And the aging population of California is going to be skyrocketing in decades to come. And the spending that we're going to have to put into the caregiving space is going to be unprecedented. We're really hoping, frankly, that we do put care first, and that this human infrastructure, if you will, or this care economy is invested in at the scale it deserves to be at the federal level, and that the Biden plan starts to move forward. But in order to make that investment make sense, and in order to make sure we don't waste those dollars and line people's pockets so they can go on fancy trips or buy jets, and in fact, just take care of people like my mother-in-law and the people who care for her, we've got to get SB 650 passed. So please call your assembly member, tune in. We'll be pounding the pavement here and hopefully get this bill signed into law. So thanks for everyone for your diligence, and for the press continuing to dig here without sunlight on this and without a spotlight. We're going to be fighting in the shadows, and we're going to be in some trouble. So we hope that the intention stays up, and everyone can do their part by sharing and retweeting and making some phone calls. So thanks again for tuning in, and hopefully we'll make some progress here in California.